And hello there, it is Friday. It's Lunch and Learn with me, Dr. Polly Heil-Mealey, at downtown Humble on Avenue C and Main Street, Abundant Health and Wellness Clinic. And so I'm going to give you just a few minutes to catch up with me. And today we're going to talk about balanced hormone replacement therapy. So people are coming on, so I appreciate that. As always, if we get kicked off because the router's not happy with us, we'll hop back on and move forward. So today we want to talk about hormone replacement therapy. And so there are a few things that I want to say right up front. I'm going to be using this book to help explain some things. You can see how thick it is, right? I'm not going to get through all of this in one session, right? This was a seminar presented by this doctor. He is an OBGYN medical doctor. He is awesome. I love him. His presentations are great. He now works on the good side, and he does everything holistic. And so what he said about hormone replacement therapy was really, really good. And we're seeing just a lot of people who are not understanding about their hormones. And even if you're not in menopause, this applies to you. And you're going to see some statistics a little bit later on that are going to help you to understand why we need to look at your hormones even when you're not postmenopausal. Now, this is another textbook. You can see that it's really big. I'm going to be taking some information from that as well. So I'm not going to try to overwhelm you with information, but I want you to understand that this is not a Dr. Google presentation. This is a presentation that has a lot of medical science behind it, and there's some statistics. And so hopefully it'll be interesting for you, and you'll be able to help move forward. So the reason I decided to do this is because we have a lot of women that come in. A lot are postmenopausal. Some are taking hormone replacement therapy. And hormone replacement therapy, if it is not organic, if it is not made from plants, is very detrimental to your heart. And so what we want to do today is kind of separate, again, the facts from fantasy and help you to make some really good decisions. Now, I want to just, a lot of times when people are looking at holistic, they have to change the way they think about some things. So we're going to look at functional medicine, which is what we do here in the clinic. So an average physician treats disease. A good physician will treat the symptoms before a disease manifests. But an excellent physician will treat the abnormality before the symptoms and the disease presents. Okay, so this is what we want to do here. We want to be that excellent doctor that's going to look at abnormalities or anomalies in the blood work. We always like to look at blood work, and a lot of people wonder why we want to look at blood work, but we do. Okay, we do want to look at that. So on your blood work, a lot of times they won't do a hormone panel unless you're having trouble with conception or unless they want to see if you are menopausal. But hormones change with age. So even if you are only over 30 years old, you are having a decrease in your hormones. So when I talk about hormones, particularly today, we're gonna focus on estrogen and progesterone because that's just how I decided to do this today. But when we're talking about hormones, we're also talking about your thyroid, your adrenals, your pancreatic hormones, your pituitary, pineal, hypothalamus glands, your thyroid, and your thymus. So all of the glands make a hormone, and there is a hormone cascade. Now I want to show you this just so you can get an idea. At the very, very top of the chart up here, at the very top is cholesterol. And if you look, this is how all of your hormones are cleaved from testosterone. Now, I'm looking at this backwards, but I think over here is where you've got your estrogen and your testosterone way, way down on the bottom of the list. So a lot of people think that your hormones are just your sex hormones, and we are talking about sex hormones. But if you don't have the right amount of cholesterol, if you're not making the right amount of pregnenolone, if you're not making the right amount of DHEA, and etc., you're not going to make the right amount of progesterone, progesterone, estrogen, and testosterone. And yes, women, we have testosterone as well. So let's look at hormones that change with aging. So hormones build up tissues and improve immunity. They decline with age. So by 50, you're only making 80% of your hormones, right? So this is your DHEA, your testosterone, and your human growth hormone. So when I'm looking here, this is where your DHEA is, right here. So if you don't have enough cholesterol, and hopefully none of you are on cholesterol medicine, because if you don't have enough cholesterol, oh, my lights are going out. If you don't have enough cholesterol, then you're not going to be able to make all these hormones, and this DHEA right here is a hormone precursor. So progesterone starts to decline at the age of 30, and your estrogen is essentially gone by the time you are 50. So even if you're having cycles after 50, your estrogen is almost gone anyway. Thyroid production declines, insulin output decreases, and you have 20 years of hormone insufficiency by the time you're 50. So this is something that people don't talk about, and so we want to talk about that. So there's a new paradigm, right? We should override our deteriorating endocrine system with balanced hormone replacement therapy. Now, your endocrine system, that is all of your organs that produce, all of your glands that produce hormones. So you've got 3 in your brain: your hypothalamus, your pituitary, and your pineal gland. In your neck, you've got your thyroid. Under that, you've got your thymus. You've got your parathyroid glands right here on your thyroid. You have your adrenals that sit on top of your kidneys. You've got your pancreas, which is in the biliary tree in the gut. And then if you're a woman, you've got ovaries. If you're a man, you've got testicles. So all of that system works together, and you've got your brain telling your adrenals and your ovaries and your testicles what hormones to make. So if you're just working at the bottom of the food chain, which is where testosterone and estrogen are, you're not being very smart. And so this is what we kind of want to look at. So restoring youthful hormone levels is essential to preventative medicine and to the treatment of all diseases. This is what Dr. Monaco, this is the guy that did this presentation. This is what he said. And so we want to look at this, and we want to look at what he says. And so what he says, that all symptoms are indicators of imbalance. They are not something to treat. So when you go to your medical doctor and you say, I've got XYZ symptom, he's going to give you a drug to treat that symptom. What we're looking at is the symptom is telling us what imbalance we have. We go in and we correct the imbalance, and then the symptom will go away. Correct the imbalance, and the systems will usually resolve, and your body will return to auto-regulation. That means your body knows what to do with the different hormones. It knows how to work on that. So hormone response is unique to each and every individual. So there's not a one size plan fits all. And so I'm just going to throw that out there. That's not going to work for you. So we want to do hormone balance. Now, hormone balance is critical to health, and it is critical to disease prevention. And so that's what I'm looking for in my life. I want to have absolutely no sickness and no disease. I want to be able to get older. I want to be able to still do what I'm doing now. And I don't want to have these dreaded age-related diseases, because that's just not what I think that God intends for me, okay? So balanced hormones are protection against cardiovascular disease and breast cancer. So we're looking and we're seeing that breast cancer is on the rise. we're looking and we see that 95% of cardiovascular disease happens to women when they are past menopause. So there's a great correlation with proper sex hormones and prevention of cardiovascular disease, which is what we want, okay? Unbalanced hormones contribute to an increased risk of all cancers, including your breast cancer. So we don't want to do that, okay? So I'm trying to figure out where I am on the page, what we want to look at here. Okay, so let me see where I want to go with this. Okay, so there are bioidentical hormones, and everything out there that says it's bioidentical is not bioidentical. I just want to throw that out there. Your bioidentical hormones, right, are chemically converted from yams or soy, right, which are identical in composition to the human hormones. They are not patentable. That means, you know, you're not going to find them in a prescription because they're not patented. They're used in Europe and the United States for more than 60 years. They've been clinically researched. Estradiol, progesterone, and testosterone are FDA approved. And so this is what we want to look at. So when you are going to the doctor and the doctor is saying, we want you to be on some hormone replacement therapy, what you want to ask your pharmacist, and they're going to send you probably to a compounding pharmacist, and you're going to ask the pharmacist what plant made this compound. And so the medical doctor that we're listening to says that they come from wild yams or soy. Now here in the United States, almost all of the soy is genetically modified. So for that reason, I would not want to have bioidentical hormones that are made with soy unless they're made with non-genetically modified soy. Your wild yams, of course, usually are not genetically modified, but you also want to check on that. So you want to ask your pharmacist, if you're taking those kind of hormones, what plant they were made from. There are a brand of bioidentical, so-called bioidentical, and when we ask the doctor what they are, he just gives us a chemical name, so they're not made from plants. So I'm a little bit kind of crazy with that. So your sex hormones are actually more than sex hormones. And so a lot of times people come in, older women come in, they're in menopause, and they'll say, oh, I don't care about sex hormones, I'm so over sex and all that kind of stuff. So that's really like a sad attitude to have, because God made sex, and sex is good, and sex is healthy, and there's just a lot of good things about it. And so we do need the proper ratio of sex hormones. Okay, so estrogen, progesterone, and testosterone control many aspects of cellular growth and the function of all tissue. So what is cancer? Cancer is uncontrolled cellular growth, right? And so as women, we need to really make sure that our hormones are balanced. So the sex hormones help us maintain normal brain function. So what's going on when we get older? We've got neurological diseases, we've got depression, we could get Alzheimer's, we could get Parkinson's, we could get dementia, all that kind of stuff. There's a lot of information out there that says if we keep our hormones balanced, we can protect ourselves against that. So your hormones, your sex hormones, are great modulators against foul moods, brain fog, pain, and all of that. So when we maintain proper functioning of the immune system, progesterone and estrogen and testosterone are immunosuppressant, okay? So that means that if you're not in proper balance, right, then your immune system can go crazy. A lot of people talk about boosting the immune system. We don't want to boost the immune system. What we want to do is strengthen the immune system. We want your immune system to be really, really quiet, So your body is functioning the way it needs to. If a pathogen comes in, your lymph and all that, it just takes care of it. Your white blood cells take care of it, move it out of the body. Your lymph nodes do what they need to do, and you're good to go. When that's not happening, then you get this flare of the immune system, this boosting, because the body's not able to handle things the way it needs to. So there's a little bit maybe confusion out there that we have people come in all the time, I want to boost my immune system. No, you really don't. You want to strengthen your immune system so that your immune system handles what it needs to handle without that boost. So your sex hormones maintain your hair, your skin, your bones, your muscle, your blood vessels, and other connective tissues. So if you're having varicose veins, if you're having spider veins, all that kind of stuff, you may need some balanced hormone therapy there. So we want to look at that. So I want to turn my page here. Okay, and I want to give you some information. Okay, so estrogen, progesterone, testosterone, DHEA, pregnenolone, cortisol, and thyroid hormones. So all of those were in this particular hormone cascade chart, okay? Cardiovascular disease. Cardiovascular disease is the #1 non-cancer cause of mortality in men and women. #1 cause. It is more common in men and post-menopausal women than in pre-menopausal women. Post-menopausal women, cardiovascular disease is on the increase. And so before I went to this class, and I went to this class in 2016, before I went to this class, I was not doing any hormone replacement therapy because I didn't know I needed to. I wasn't having any hot flashes. I wasn't having any vaginal dryness. I wasn't having any losing my hair. I wasn't having any osteoporosis, all of those known low estrogen factors. But when I went and heard Dr. Monaco, I think that's his name. Yeah, Dr. Monaco. When I went and heard him, and he was saying every woman needs to be on pregnenolone and needs to be on estrogen, because estrogen protects the heart against cardiovascular disease. So I don't know everything. I don't pretend to know everything. But one of my tenets is I don't work hard, I work smart. And so that means I collect all the smart people around me and I listen to what they say and I do what they say to do so that I can be healthy. So the rise of cardiovascular disease is related to the decline of estrogen levels. And there is vascular benefit to endogenous estrogen. Now, endogenous means it comes from the body or it is identical chemically to what your body makes. Exogenous estrogen is what you're going to be getting when you have Premarin and different prescriptions that are in the traditional hormone replacement therapy. So we want to make sure that we look at that. Menopause is not a disease. It is a rite of passage, but your lack of estrogen could affect your cardiovascular function. So we want to make sure that we look at that, okay? So when we have a higher risk of cardiovascular dysfunction, we've got hypertension, we've got high cholesterol, we could have diabetes, we could have obesity, and smoking. So smoking we can stop, obesity we can stop, okay? We can handle that. If we take care of those two things, we're not going to have a cholesterol issue, and we hopefully will not have a hypertensive issue here, okay? So we want to look at the cardiovascular function. So as I said earlier, 95% of cardiovascular events happen for a woman after menopause, right? Endogenous estrogen, this is estrogen that your body makes or is in the same chemical constituent as what your body makes, reduces the progression of cardiovascular disease, so it protects our heart. Menopause is a risk factor for increased atherosclerosis, atherosclerosis is hardening of the arteries and plaquing in the heart, okay? So when we're looking at these things, we see that there are studies that show a 40 to 50% reduction of cardiovascular morbidity with hormone replacement therapy, okay? So this is really, really important, very important. Studies have shown that estrogen replacement therapy is associated with a 50% reduction in cardiovascular disease. And so we want to look at that. There were 4 studies, randomized clinical trials, okay? There were 4 of those that questioned the protective role of hormone replacement therapy. And what they found is that when you used a synthetic, you were increasing your cardiovascular disease. But when you are using bioidentical that has the same hormone configuration, chemical configuration is what your body makes, you reduce your chances of cardiovascular events by up to 50%. So just regular going to the doctor, getting a prescription for hormone replacement therapy may not be in your best interest with your heart, but if you do the bioidentical route, then you are getting some good results with that. So I was looking at some statistics. Let me see if I can find that page. My pages aren't numbered, so that makes it a little bit crazy here. Okay, so estrogen has a beneficial effect on your cardiovascular profile. Hormone replacement therapy that is biological appears to be associated with favorable protective effects on cardiovascular disease. It appears to be mediated through the HDL levels. Now, your HDL is your positive or your good, healthy cholesterol. So one little statistic I want to show you here has to do with having your ovaries removed. Now, a lot of people have had, let me see if I can find that. I just had it a while ago and I looked over it, but I really want to say something about that when you have your ovaries removed. Yes. Where is that? Yes. So there is increased cardiovascular disease when you've had your ovaries removed. Why? Because your ovaries are one of the organs that produce your estrogen, okay? So just want to throw that out there. There's an increased risk of cardiovascular disease with a woman who has had her ovaries removed. Okay, so what do you do? Okay, what do you do? Well, we have a few things here in the clinic that we do because we're really, really careful to work with the women that we have. We do want you to change. If you're on bioidentical hormones, we want you to go back to your compounding pharmacy and ask what plant it comes from. If you're not on hormone replacement therapy, then we want to help you out. And so this is what we have here in the clinic. Now, Dr. Monaco says that he prefers topical instead of injectable. Just going to throw that out there. I don't know that he knows a lot about the herbal world because he's an MD, even though he's on the good side now and he wants to do things very, very holistic and very proper. He actually is a medical advisor for this company. This is from Biotics Research. Biotics Research is right here in town. We get a lot of our products from them. And so I just want to go over a few products that you may need. So we're going to start with the younger women. Remember, by the time you are 30, you are already losing some of your hormones. So the main symptom that a woman's going to have is that your periods are irregular. Your periods could be very, very heavy. Your periods could last longer than they need to. So this is a great herbal formula. It was formulated by a craniosacral therapist here in the Houston area. No, she doesn't live in my office, but she's really good and I know her. And this is thebomb.com. I'm just telling you, we've given this to women in their 30s who had their hormones not regulated. We've given it to women in their 30s who wanted to have a baby, they couldn't get pregnant, and this just balances. It is an adaptogenic form, and what that means is on any given day, if you need more estrogen, you need more progesterone, whatever, this is your formula because it's going to moderate and modulate your hormone levels. Great for menopausal women. We've got many, many menopausal women on this, alleviates hot flashes, all that kind of stuff. This is like I said, thebomb.com. This is one that I use. Yes, I'm postmenopausal, so I do that. We've got your topicals. Now, these are topical. This one is your progesterone. This one is your estrogen. This is made by our good friend, Dr. Julia T. Hunter. She also is a medical doctor, but she makes good, organic, bioavailable hormones. So these are good. I use these too. And so why do I do that? Because the medical doctor gynecologist said if I want to avoid a heart attack and cardiovascular disease, I need to do that. So I do 2 pumps of each twice a day. Soft skin. So I do it on my belly or I do it on my inner thighs, anything like that. We also have this. If you don't like the way liquids taste, this is called Warmy. This is a Ayurvedic medicine. So Ayurvedic is from the Indian with a dot, not a feather. So this is over in the continent of India, Ayurvedic medicine, which is very, very good, very sound. Lots of clinical research on this. You take 1 pill, I think it's 3 times a day. This is what it says. It's highly effective proprietary blend of Peruvian vegetable fruit extracts offering full spectrum relief in menopausal and postmenopausal study. In one double-blind clinical study, Warmy produced significant menopausal symptom relief and sexual improvement in as little as 30 days. 1 capsule 3 times a day. So it takes at least 30 days for you to see any benefit, and the more you do it, the better the benefits get. Love this. We have this, so we've got that as well. If you are having problems sleeping, Dr. Monaco says that pregnenolone is something that every woman needs. Why? Because it is a hormone precursor. So in our little chart, back to our little chart, we've got cholesterol right here at the top. What is the next one? The next one is pregnenolone. So if you don't have enough pregnenolone, you're not going to have enough hormones or enough of the raw material to make your sex hormones. So he says everybody needs at least 25 milligrams of pregnenolone at bedtime. It's going to help you sleep. It's going to help you have all the raw material so that you make your hormones. So I do this one too. DHEA is another hormone precursor. Now, I don't do this one regularly because I don't need to, but your DHEA back down here is here, right? So cholesterol, pregnenolone, progesterone, right? So progesterone, that's a sex hormone, but look how high it is. Then your pregnenolone goes to progesterone, but it also goes to 17-hydroxypregnenolone. So it's a derivative, it's a metabolite of the pregnenolone up here. From that, you get your DHEA. Your DHEA splits off into your different estrogens, then your progesterone, and then even after that, it comes down to the metabolite of estrogen that we need to be cardioprotective. So if your hormones are way, way out of whack, if you are very stressed, if your cortisol is out, if you've got adrenal fatigue, then you're probably a victim of the pregnenolone steal, which means your pregnenolone is going to make cortisol, not going to make your DHEA. So these are things that we can test for. We've got blood spot testing here in the clinic. We also have saliva testing here in the clinic. We send it off to the lab and it can give you what your specific hormones are so that we don't treat you inappropriately, but we treat you appropriately. This is DIM. DIM is another hormone precursor. If you have breast cancer, if you are a man and you make the wimpy testosterone, right? We talked about that last week. DIM is an aromatase inhibitor. An aromatase inhibitor will stop the conversion of real testosterone, manly testosterone, to wimpy testosterone. It will stop that progression. We also have it in a pill form. I didn't bring it in, but that's another story. If you've got estrogen receptor breast cancer, this is a really good product to have. Aromatase inhibitor, it's going to stop that estrogen from going where it will proliferate your breast cancer. So all of that is a lot. That's a mouthful. The last product I want to show you, this is called the Response Cream. It actually is called Response Arousal Cream. So a lot of times, menopausal women or women that don't have the right hormones, you're not going to be able to be well lubricated during intercourse, and so intercourse can be very painful. This is it's not a lubricant, it's not, but it is something, it is a cream. I'm just going to be real honest with you. It is a stimulating topical cream that you apply a few minutes before sex to get things going in a natural way. So this is a clitoral stimulating cream, right? So we have given this to many, many women, and I love what one of our ladies said. She said, "Oh, I'm 65. I'm past it. It's not going to happen. It takes too long. I don't get aroused. It's all dead down there." And I said, "Well, try and see." And so she called me a couple of days later and she said, "Oh my goodness." She said, "I haven't felt this well in a long time." She said that she was able to respond to her husband. Her body responded. And so if that is an issue for you, we've got this as well. It is made, I'll just tell you, it is made up to California standards, so all of the things that could be cancer-causing are not in there. There's no parabens, no mineral oil, no petroleum, no animal, anything. So this is very good. It's very, very safe, and it works. So hopefully, I told you I wasn't going to go through the whole manual today. I'm just giving you this little snippet so that you can look at what's going on with your hormones so that you can age gracefully, and you're going to protect yourself from cardiovascular disease. We also want you to be functioning normally sexually, because sex is a great it has great immune response, okay? So we just want to just throw that out there. It's good for you. It's good for you mentally. It's good for you physically. It's good for you emotionally. And it's good for your relationship. And so, when I look at the Bible and I see that, Sarah has this baby when she was like 100, and I'm thinking, you go, girl. And no, I don't want to conceive right now, but I certainly want to be able to practice. So these are some things that will help you keep your hormones balanced in a healthy way, and you will protect yourself from cardiovascular events. So this is my spiel for today. It is the weekend coming up, so I hope you all have a great weekend. Thank you so much for joining me today. If you have any questions, pop them in the box, and I will answer them later. And share this with your friends. If you have any questions, let me know. Love you guys. Thanks so, so much.